Dr. Cronje, just caring for homeless patients. Sonstraal Hospital is primarily a TB hospital and for TB treatment. But what are some of the challenges when you guys have to care for the homeless?
I think one should not categorize a homeless patient as a different patient. They've just got different challenges to what let's say the run-of-the-mill or normal community members have. The reality is very often it is obviously an environment where something like food security is not there. That leads to malnutrition and a higher risk of severe TB disease, and number one, contracting TB, and then the severity of the disease normally is also increased with suppressed immune system secondary to malnutrition. Those patients typically, since they do not live in a social structure, or let's say they also do not seek healthcare timeously. That's a typical pattern, is not always the case. Delaying diagnosis of TB is always detrimental to health. Getting your diagnosis done, getting onto efficient treatment is critical in the management of TB. Waiting for too long can actually make TB incurable, or simply can kill you, or it can leave with significant, the patient can be left with significant permanent damage, mostly to the lungs, what we find, but there are other issues that can also spring up. The most dangerous one is when TB spreads to the brain, which we call TB meningitis. That can leave a patient with a stroke and some other neurological deficits, which is very often permanent. Now, if that scenario where a homeless person that was functioning relatively well and autonomously out in the, let's say, in the streets, once, if they are able-bodied, they carry on quite well. If they present with symptoms, get onto treatment quickly, they can be cured, and as any other person, and they can, let's say, integrate into the environment, community, with the same functional state that they had previously. They will be autonomous. They can do whatever they need to do. The risk is, however, if you delay and you damage your lungs enough by not getting on treatment or not completing treatment, or ending up with TB meningitis, you can either end up with a stroke or severe let's say not inability, what would put the word, severe restriction in exercise capacity. A person like that may not be able to walk at a brisk pace or even go uphill without resting. So getting along on the streets and scarling, as some people would call it, that would become it would pose a challenge for such persons. Now, if you were able-bodied, end up with a stroke due to TB meningitis or other neurological fallout, blindness, or whatever the case may be, such a person will most definitely struggle severely out on the stage. Getting along in a wheelchair, for example, may be the only way of mobilizing. Obviously, that's a major problem. our healthcare workers, and I'm talking from doctors right through to nursing staff, allied healthcare workers, social workers. It remains a big ethical dilemma on how to discharge those patients back into their environment. Something that we don't always understand or have a good grip on it. It's just difficult to understand what to do with the patient, that homeless patient that now has got permanent disability, and I think a logical conclusion would be that that patient cannot function, let's say, in such a way that they can care for themselves in a relatively safe manner out on the street. So that it always remains an ethical issue for our healthcare workers. It also, since there are very little care environments into which such patients can be discharged, that remains a challenge. And then also you have patients that are just reluctant to move to facilities where they need to submit to rules and regulations and stuff like that. And many of our homeless patients, not all of them though, some end there not by choice on the street or being homeless, but some do it by choice, and they prefer to be on the streets. It's also a very difficult concept, and I don't want to say too much about that, but yeah.